Hello and welcome back to Medical Videopedia, and in this video we cover the symptoms and signs of eczema, also called dermatitis. In the word dermatitis, derm means skin and itis means inflammation. Eczema originates from the Greek word ekzein, which means to boil over or to break out. It's an inflammatory skin condition that causes itchiness, dry skin, rashes, scaly patches, blisters, and skin infections. Eczema damages the skin barrier function. The loss of barrier function makes your skin more sensitive and more prone to infection and dryness. More than 31 million Americans have some form of eczema. Eczema can begin during childhood, adolescence, or adulthood, and it can range from mild to severe. You're at higher risk of getting eczema if you are female, African American, diagnosed with hay fever or asthma, part of a family with a history of dermatitis, hay fever, or asthma. While there are 7 different types of eczema, the most common type is atopic dermatitis. It's most common in babies and children, but adults can have it too. In infants, eczema usually appears as tiny bumps on the cheeks. Older children and adults often experience rashes on the knee or elbows, often in the folds of the joints, on the backs of the hands, or on their scalp. As children who have atopic dermatitis grow older, this problem may get better or go away. But sometimes the skin may stay dry and get irritated easily. However, for adults who continue to suffer, it can become a serious condition. Adult eczema is a chronic condition that involves inflamed, red, itchy patches of skin that can erupt in sporadic flare-ups. Different areas of the body can be affected for adults, including their face, hands, and even eyelids. The itching for adults can feel unbearable, as flare-ups can affect skin all over the body. It is unusual to develop eczema after the age of 60. If it does occur, then it usually has to do with a more serious underlying medical condition, and you should see your doctor. It's important to know that eczema is not contagious, and the cause of eczema is still unknown, but it's likely caused by genetic predispositions and environmental factors. Eczema may get better or worse over time, but it's often a long-lasting disease. People who have it are also more likely to develop hay fever and asthma. The first signs of eczema are itchiness and redness. Eczema can show up anywhere on your skin. In teens and adults, it's typically found on your hands, neck, inner elbows, ankles, knees, feet, and around your eyes. Eczema is caused by a combination of immune system activation, genetics, environmental triggers, and stress. If you have eczema, your immune system overreacts to small irritants or allergens. This overreaction can cause your skin to become inflamed. There are a number of things that may trigger eczema symptoms, and these can vary from person to person. Common triggers include irritants such as soap, detergent, and shampoo. Environmental factors or allergens such as cold and dry weather, dampness, and more specific things such as house dust mites, pet fur, pollen, or molds. Food allergies, such as allergies to cow milk, eggs, peanuts, soy, or wheat. Certain materials worn next to the skin, such as wool or synthetic fabrics. Hormonal changes. Women may find that their symptoms get worse in the days before their period or during pregnancy. Or skin infections. The signs and symptoms of eczema include dry skin, itchy skin, red rashes, bumps on the skin, scaly leathery patches of skin, crusting skin, and swelling. If you have eczema, you might find that you have another condition that doesn't cause it but is often found alongside it. These conditions include allergies, asthma, depression, sleep loss, and anxiety. Certain types of weather can actually make eczema worse, including low humidity, which can dry out your skin. And sweating caused by high heat can make the itchiness become unbearable. Eczema can be lifelong, but symptoms can be managed with at-home remedies, over-the-counter medication, and prescribed medications. To this day, there's still no known cure. As many as 15 to 20% of people experience eczema or another form of dermatitis at some point in their lives. If your symptoms are making you miserable, An immunologist, often referred to as an allergist, can help. An allergist has advanced training and experience to determine what is causing your symptoms and can work with you to develop a treatment plan to help you feel and live better. Thanks for watching. Please like, comment, and subscribe if you feel this information has helped you in any way. Please feel free to share this video with your friends, family, or anyone else that you may feel like may benefit from this information. Talk to you again soon.